So hi, I'm Kate. I am the clinical nurse consultant and TB coordinator for the TB services in Nepean Blue Mountains. It's a one nurse clinic. DOT is a huge part of TB treatment for active cases. It does stand for directly observed therapy, and it's a standard that the World Health Organization has set for TB care for a number of reasons. So for most people it seems like a necessary evil as part of their TB treatment. It is the method of which their medication administration is actually observed. Each dose has to be observed to be swallowed.
So the Telehealth and Technology Centre has been innovative in developing new telehealth enabled models of care. Joining the dots is a perfect example. So it's using readily available video conferencing, but we're also involved in developing models around app development and remote patient monitoring as well. And that's across our whole district and also into other LHDs for some of our initiatives.
The beginnings of telehealth, once I got in contact with Tanya, it was just too easy to set up, and she was there from the minute go, guiding us through the process. If there are any technical issues, she's just a phone call away. So for the patient and myself, we have an agreed time, just like an appointment, to have the teleconference for the DOT, and they will log in at that time. Some patients prefer to call. It is about that regular contact with an actual specialised service in TB. It's regular contact with medication side effects, monitoring any problems there, monitoring for return of disease or drug resistance, and counselling through their treatment. How to swallow 30 tablets in one go and coaching them through that. For others, they may not have even told their family that they have a diagnosis of TB because of all of the stigma associated with the TB disease. So we're their sounding board for that. But there's also a lot of misinterpretations about TB when that first starts, when they're diagnosed, and they also have a lot of questions that come and go. Maintaining that contact and developing that relationship and rapport with the patients, just as if they were coming in for an appointment, but them not having to come to the hospital during my specific work hours, paying for parking. The concerns about a one nurse clinic is that unplanned leave is not necessarily relieved. So in this case, if there is unplanned leave, my patients have been fully assessed as competent to dispense their medications. They have access to those medications, and all that's required is a phone call to say, hey, you won't be doing a video today, can you take your medications yourself? Patient empowerment. Not only with the independence of them being able to dispense their meds, so decreasing that paternalistic feel, but then being able to choose the time they log in, have a bit more flexibility around access to TB care that's appropriate and safe.